Diabetes, also known as diabetes mellitus, is a chronic health condition that affects how the body uses glucose, sugar, as a source of energy. Glucose is a substance that comes from the foods we eat and is transported to the body's cells by the hormone insulin, which is produced by the pancreas. Diabetes occurs when there is a problem with the production or response to insulin, resulting in elevated levels of glucose in the blood, known as hyperglycemia. There are primarily two types of diabetes. 1. Type 1 diabetes. In this type of diabetes, the immune system attacks and destroys the insulin-producing cells in the pancreas. As a result, people with type 1 diabetes cannot produce enough insulin to regulate blood glucose levels and require insulin injections to survive. Type 1 diabetes typically develops in childhood or adolescence, and its exact cause is not known. 2. Type 2 diabetes. In type 2 diabetes, the body does not use insulin effectively, or the pancreas does not produce enough insulin to meet the body's needs. This type of diabetes is often associated with excess weight, lack of physical activity, and genetic predisposition. It is more common in adults but can also affect children and adolescents. Type 2 diabetes can usually be managed with lifestyle changes, including a healthy diet, exercise, and, in some cases, medication. Uncontrolled diabetes can lead to a range of serious complications, including heart problems, kidney damage, nerve damage, neuropathy, vision problems, foot ulcers, infections, and even amputations. Therefore, it is essential for people with diabetes to receive regular medical care and follow a personalized treatment plan to keep their blood glucose levels within the target range. The treatment of diabetes aims to control blood glucose levels, prevent complications, and improve the quality of life. This may involve monitoring glucose levels, administering insulin or medications, adopting healthy eating habits, and engaging in physical activity. Each case of diabetes is unique, and treatment is tailored to the individual needs of each person. The symptoms of diabetes can vary depending on the type of diabetes, type 1, type 2, or gestational, and the severity of the condition. Many people with diabetes may not exhibit obvious symptoms, while others may experience various symptoms. Below, I detail the most common symptoms associated with diabetes. 1. Excessive thirst. Polydipsia. Excessive thirst is a prominent symptom of diabetes due to elevated blood glucose levels. When glucose levels are high, the body tries to eliminate the excess sugar through urine, leading to fluid loss and dehydration. As a result, the person experiences intense and constant thirst. 2. Frequent urination. Polyuria. Frequent urination occurs because the kidneys have to work harder to filter and eliminate excess glucose from the blood. This results in increased urine production. People with diabetes may feel the need to urinate multiple times during the day and often wake up at night to urinate. 3. Excessive hunger. Polyphagia. Excessive hunger is related to the cell's inability to use glucose properly. As a result, the body doesn't receive the necessary energy, leading to a constant feeling of hunger even after eating. 4. Fatigue. Fatigue is a common symptom of diabetes due to glucose not being used as an energy source else. As a result, a person may experience extreme tiredness and lack of energy, even after adequate rest periods. 5. Blurred vision. Fluctuations in blood glucose levels can temporarily affect the ability of the eyes to focus. This can result in blurred vision, especially when glucose levels are very high. 6. Slow healing wounds. Diabetes can impair blood circulation and the healing process. This means that wounds, cuts, and scratches may take longer to heal, and infections may be more likely to occur. 7. Recurrent infections. Diabetes can weaken the immune system, making a person more susceptible to infections. Urinary tract infections, skin infections, and gum disease are common in people with diabetes. 8. Tingling or numbness. Neuropathy. Diabetic neuropathy is a complication of diabetes that occurs due to damage to peripheral nerves. This can result in tingling, numbness, burning sensations, or pain extremities, such as hands and feet. These symptoms can be debilitating and affect the quality of life. 9. Mood changes. Uncontrolled blood glucose levels can affect mood. Fluctuations in sugar levels can lead to irritability, anxiety, depression, and emotional changes. 10. Recurrent fungal infections. Diabetes can increase the risk of fungal infections, such as candidiasis. These infections occur in the mouth, oral candidiasis, on the skin, cutaneous candidiasis, and in the genital organs, genital candidiasis. In addition to these symptoms, it's important to mention that type 1 diabetes has specific symptoms, such as unexplained weight loss and diabetic ketoacidosis in severe cases, characterized by fruity-smelling breath, mental confusion, rapid and deep breathing. Type 2 diabetes is often asymptomatic in its early stages, and symptoms can be more subtle and gradually progressive compared to type 1 diabetes. That's why regular medical exams and blood glucose tests are crucial for early diagnosis and effective control of diabetes. Proper treatment and management of diabetes aim to keep blood glucose levels within the target range and prevent long-term complications. Specific symptoms of type 1 diabetes. 1. Unexplained weight loss. Weight loss is a common symptom of type 1 diabetes, often occurring before diagnosis. This happens because in type 1 diabetes, the body either doesn't produce insulin or produces very small amounts, preventing cells from receiving glucose for energy. As a result, the body starts breaking down fat and muscle reserves for energy, leading to weight loss even if the person is eating normally or even more than usual. 2. Intense hunger. Intense hunger is another characteristic of type 1 diabetes. The body's cells are starving for glucose as they cannot use it properly due to the lack of insulin. This leads to a constant feeling of hunger, even after eating. 3. Diabetic ketoacidosis. In severe cases, diabetic ketoacidosis is a severe complication of type 1 diabetes that occurs when blood glucose levels are extremely high, and the body starts breaking down fat for energy. This results in the production of ketones in the blood, which can cause symptoms such as fruity-smelling breath. Due to the presence of ketones in the blood, a person may develop a characteristic free odor on their breath. Mental confusion. Ketoacidosis can affect brain function, leading to confusion, disorientation, and even coma. Rapid and deep breathing. Rapid and deep breathing, known as hyperventilation, is the body's attempt to eliminate excess ketones through respiration. Diabetic ketoacidosis is a medical emergency that requires immediate treatment in a hospital, as it can be potentially fatal if not treated properly. Specific type 2 diabetes symptoms. 1. Frequent or recurrent skin infections. People with type 2 diabetes have a higher risk of skin infections due to a combination of factors, including compromised immune system and elevated blood glucose levels, which can promote the growth of bacteria and fungi on the skin. 2. Dark spots on the skin. Acanthosis nigricans. Acanthosis nigricans is a dermatological condition associated with insulin resistance, which is common in type 2 diabetes. It manifests as dark, velvety, and thick patches on the skin, typically in the armpits, neck, groin, and skin folds. These patches do not cause pain but can be a warning sign of the presence of type 2 diabetes or prediabetes. 3. Subtle and gradually progressive symptoms. Symptoms of type 2 diabetes can be more subtle and develop over time. Many type 2 diabetes do not exhibit obvious symptoms initially, which is why early diagnosis through routine tests is important. Symptoms may include fatigue, excessive thirst, frequent urination, and blurred vision. These signs may not be as pronounced as in type 1 diabetes. Gestational diabetes symptoms. 1. Often does not present obvious symptoms. Gestational diabetes typically does not have obvious symptoms. Many women may not notice any symptoms. 2. Increased thirst and urination. In some cases, although most women with gestational diabetes do not have noticeable symptoms, some may experience increased thirst and urination. This is due to elevated blood glucose levels. 3. Diagnosis during pregnancy. Gestational diabetes is diagnosed during prenatal care, usually between the 24th and 28th weeks of pregnancy, through glucose testing. The test is routinely performed in pregnant women to assess the body's ability to regulate glucose during pregnancy. 4. Disappears after delivery. Gestational diabetes usually disappears after childbirth, but women who have had it have increased risk of developing type 2 diabetes in the future. Therefore, it is important to have regular tests to monitor glucose levels after delivery. Remember that each person is unique, and symptoms can vary. If you suspect you have diabetes or gestational diabetes, it is essential to consult a healthcare professional for proper evaluation and guidance. Early diagnosis and treatment are crucial for the well-being of the affected individual and the fetus, in the case of gestational diabetes.